topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Tennessee. Welcome to another Ask the Expert show, where we bring you the finest experts in the field of legal, health, financial, and home improvement. I got to tell you, we were so lucky we found the greatest eye institute in the state of Tennessee when we found Wang Vision Institute. In fact, a friend of mine who lives in Nashville, I told him that we have a eye surgeon who's our expert on the show, and he said, "Who is it?" And I said, "Wang Vision Institute." He said, "They did my surgery." He had LASIK done. They did my surgery, and it was the best thing ever. Everybody was so nice there, and it's just so nice. And I knew, because we've heard so many great things about Wang Vision. Now, if you've been listening to the show long enough, you know we have the incredible Dr. G with us today. Good afternoon, Dr. G.
Good afternoon, Steve. Thanks for having us, as always. It's my pleasure, my honor to be on the show.
Listen, today you got me. You know, we always tell you, you can pick out the areas of eye disease and eye surgery, and you come up with this eye surgery that you treat. That's got to be one of the hardest words I've ever pronounced. Pronounce it for me.
Yes. Today we're going to be talking about a condition called keratoconus.
You say it so easily.
So keratoconus.
That is, I guarantee you, most of our audience, because we've already been getting letters, people going, "I've never heard of this type of surgery." But before we get started, tell us about Wang Vision Institute.
Yeah, Wang Vision Institute has been around Nashville for about 20 years. So we are kind of a premier cataract and refractive surgery specialist. So we do 8 different surgeries to help patients out of glasses. So the eye is only an inch long, but there's over 12 subspecialists within the eye. So I trained at Hopkins, Duke, and then I did a subspecialty in what's called refractive surgery. So we're specialists in kind of helping patients out of glasses, no matter how you want to get there. But we also are kind of experts in dry eye and still do medical care as well.
Well, from what I understand, this area we're going to be discussing today is a progressive eye disease, and it's in the front of the eye. Is that correct?
That's correct. So keratoconus is a disorder of the cornea. So the cornea is the window to the eye. You know, you probably have heard a lot about astigmatism. So the cornea is the window to the eye. And when people are talking about astigmatism, oftentimes they're talking about the shape of the cornea. So normally it's supposed to be shaped like a basketball. People with astigmatism, it's shaped a little bit like a football. But with keratoconus, what happens is it's very irregular. So that cornea starts to bulge and it starts to distort, which can lead to blurry vision, distortions, glare, halo, and if left untreated, it can lead to what's called corneal decompensation, and people would need what's called a corneal transplant.
Now, how would a person know what kind of effects are they going to see with their
Yeah,
eyes that they know that
good
maybe they
question. I
have this
mean,
problem?
symptomatically, they would be having kind of ghosting of images. They would be having blurring, increased sensitivity to light. Other tools that people can use is if their prescription keeps changing, especially if the astigmatism keeps changing every year, every few months. If glasses or contacts are just not helping you see clearly, these are all signs that you better go see an ophthalmologist to make sure that you don't have this condition. So it's a condition that's kind of has a genetic component to it, and then also an environmental component to it. So oftentimes people have a family history of the disease, and certain races are a little bit more prone to it than others.
And Steve-O, you having issues with your headset? You're on mute. While we get Steve back to where we can hear him off of mute, let's see about another question that people might
Okay,
have for you. Oh, there he is.
Can you hear me now? Okay.
Yes.
I'm sorry about that, Dr. G. See, that's
No
the problem.
problem.
When you have a live show, you never know what's going to happen.
Hey, yeah.
So let me ask you, so is there a certain demographic? Is it for people like older, more mature people?
Yeah, so it's actually it's a younger demographic. So it's a disease that often starts in your 20s or early teens, and it can progress during those teenage years. There's kind of a bimodal distribution. So sometimes even older people, it can still progress, but typically it starts in your teenage years, really kind of progresses fast depending on the scenario, and then kind of stabilizes a little bit as you get older. Certain populations, like Middle Eastern populations, Hispanic populations, they're at kind of higher risk as well, just because of genetic predispositions.
What causes this?
It's multifactorial, but basically there's a weakness in the cornea that causes this bulging. So if you imagine kind of like the cornea, like a plastic bag with a bunch of tennis balls, that plastic bag will slowly deform and become very irregular. And that's what's called keratoconus. That's what's happening to the cornea. It starts to become very irregular. It's due to a weakness of the cornea. In terms of what we can do, they've shown that eye rubbing is a number one contributing factor. So if you're rubbing your eyes, you can actually accelerate the disease. So what happens is when you rub your eyes, you're mechanically pushing on that cornea, which can cause that cornea to deform even further.
We just got our first text. My eyes burn in the morning and they are very itchy. Does that sound like I could be a candidate for this?
Yeah, so I mean, what that sounds like is you've got really bad irritation from likely dry eyes. A lot of times when people are waking up, it's because what happens when we sleep, we're not blinking. And when we're not blinking, we're not replenishing the tear film. So that gritty feeling, irritation, that's all dryness. Sometimes people with keratoconus, they think they have dryness and they're rubbing their eyes because they feel dry or because they have allergies, but it can actually contribute to the cause. So you want to make sure you get evaluated, one, to treat the dryness, but to make sure, two, you don't have this condition.
What are some of the early warning signs?
So the early warning signs is kind of changes in your glasses prescriptions. If you go to the eye doctor one year and the next year the astigmatism part of the prescription changes a lot. Other warning signs is if the glasses don't seem to be really helping, you're changing out in different prescriptions. Other warning signs is you're starting to notice ghosting or haloing of letters or words, because that's oftentimes due to astigmatism.
And then what about, can you explain the kind of test you do in the office?
Yeah, so we have different kinds of tests, but essentially what we're doing is looking at the curvature of that cornea. So we have special imaging tools to tell us what the curvature of the cornea is, tell us how regular or irregular it is. So based on those tools, we're able to determine whether or not you have keratoconus. So patients with irregular astigmatism, so very deformed corneas, their vision can't be corrected with glasses or contacts. Oftentimes they need specialty contacts called scleral lenses to help mask that irregularity.
Has this kind of treatment been around for a long time? Because I was surprised. I've never heard of this before.
Yeah, so for keratoconus, there's two mainstays of treatments. One is, so we got to go back to that same analogy. One is called Intacs. So with Intacs, what we do is put a little kind of support structure. So if we imagine putting a support structure at the bottom of that plastic bag to hold up all those tennis balls, that's kind of what Intacs does. We can insert that in the cornea to kind of lift up the cornea so it doesn't continue to sag and bulge. And then kind of the more newer treatment and kind of the more treatment that's used more widely is called corneal collagen cross-linking. So with that, what we're doing is actually soaking the cornea with riboflavin and then administering UV light. And then what that does is that UV light helps that riboflavin absorb into all of the corneal molecules, so the molecules stick together much better. So if we go back to that same analogy, now the tennis balls are sticking together much better so that they don't want to sag and they want to stay together and not deform as much. And so both of these are aimed at slowing down the progression of the disease.
This is from Rick in Nashville. I don't mean to take you off topic, but it's so hard to get in for your show that I wanted to ask the doctor, because I've heard so many good things about Wang. What all different eye surgeries does Wang do?
Very good question. So we do eight different kinds of surgeries to help patients with vision concerns. So we do cataract surgery, we do premium cataract surgery, we do what are called clear lens exchanges or a dysfunctional lens exchange. We do LASIK, we do SMILE, which is kind of like LASIK but no flap. We do PRK, we do implantable contact lenses, we do minimally invasive glaucoma surgeries, and then we also have a host of treatments for dry eye, and we also do cross-linking for keratoconus.
How does, I want to kind of get back on our topic, how does this progress if it's not treated and someone just lets it go?
Yeah, if someone just kind of lets it go and you don't get cross-linking or you don't get the Intacs, that cornea will just continue to deform. So it's just going to become more and more irregular. It can lead to scarring, it can lead to hazing, and it can get to the point where glasses, contacts really don't help. The end stage of the disease, if left untreated, you would need what's called a corneal transplant. So where they remove the entire cornea and they have to put a new one on.
Wow. Does insurance cover this?
It does. It does.
Okay.
This is a medical condition that a lot of patients have.
Is it ever mistaken for like regular astigmatism?
It is. It is. Oftentimes, especially if you're following with somebody that doesn't have the imaging techniques that we have at ophthalmology offices, oftentimes, it's followed as regular astigmatism, and the providers, they don't have the tools to diagnose it. But then 1 year that astigmatism changes a lot, and now they suddenly send them to us, and then we diagnose them where now they're kind of at a moderate disease or a severe disease. So oftentimes it's underdiagnosed.
Well, it's so important that now, Dr. G, is this an area that you deal in?
Yes. This is one of the.
Because your personality, people really tend to love your personality. So
Yes.
normally you probably don't normally ask for a doctor, when it comes to ophthalmology. But and I want people to know you also do glasses and contacts too, right? At Wayne.
That's right. We give prescriptions for glasses. That's right.
And I just had a lady call. She said, when should a child first come in for an eye checkup?
That's a good question. So for us, we see kind of pediatric patients that are able to sit in the slit lamp or have an exam. So once they're above 12 or 13 and they can cooperate, we're happy to see them in our clinic. Anyone younger, we typically ask them to see a pediatric ophthalmologist. If you don't have any vision concerns and this person's vision's doing fine, it's always good to just go get a good baseline visit whenever they're able to cooperate, and then kind of from there you can follow every 2 years or so.
And I think it's called corneal cross-linking.
Yes.
Who would qualify for that?
Yeah, so that's one of the treatments that we were talking about. So that's one of the 2 treatments that we use to help slow down the progression for this condition, keratoconus. So with the cross-linking, we're strengthening the cornea. So it's no longer being weak, but it's going to strengthen it to make sure it doesn't continue to progress. Unfortunately, there's no treatments to reverse the damage that's been done. So whether that's with the cross-linking or the Intacs, we can't reverse what's done, but we can make sure it doesn't get worse.
And the lady, she just did a follow-up question. I don't know if my son, who's 14 years old, I don't know if he can't see well, why he doesn't do his homework, or if he's really got a problem. And I wanted to make sure that 14 isn't too young to bring him in.
No, it's actually a good time, especially if they're having any vision issues. It never hurts to be checked early, especially for conditions like this, because it can progress as you're becoming a teenager and you're entering your teens and your 20s. It can get worse.
And what are someone wanted to know what your hours are?
So we're Monday through Friday, from around 7:38 to about 4 o'clock.
Now, I'm not going to even try to pronounce this, but can people still live normal lives and maintain good vision long term after you've treated them?
Yes, especially if it's diagnosed early. I've had even personal friends who've been diagnosed with this condition. So it's more common than we see, and then we probably hear about it. If it's detected early, you can still preserve vision. Even if it's detected at a moderate stage or severe stage, once we slow down the progression, we can often refer patients to go get specialty contacts. So specialty contacts fit over the entire cornea so they can mask the irregularity, still giving patients good quality of vision.
Is surgery ever needed?
So these are both procedures that we actually do in the office. So cross-linking and Intacs are both different types of procedures that we could do in the office. So we don't need an anesthesiologist. We don't need a big facility for that. However, if it does get to the end stage and where somebody needs a transplant, then we'd have to refer them to go get a transplant surgery.
Well, what are Intacs?
Intax is the other procedure to help slow down the progression. So kind of back to that plastic bag and the tennis balls making the bag really deform. It's all sagging. What Intax is kind of like putting a little support structure at the bottom of the bag to hold everything up. So what we do is put a small segment in the cornea to hold everything up from it kind of sagging and bulging.
You know, Dr. G, I get so many letters from listeners for about you and Dr. Jones both. People saying it's so obvious you love what you do. And
Thank you. We do.
I thought that was the greatest compliment. And they love the way, because in your area of health, boy, you can really talk over people's heads. People really appreciate the way you explain things that people can the layman can understand. And I wanted to get that out today because people love you and Dr. Jones.
Yeah,
Thank
you. One of my really things I'm passionate about is ophthalmology and also education. A lot of people don't get access to care just because they're not aware, they're not educated. And one of the hindrances to learning is if you don't explain it properly, they're not going to understand anything. So I try to always make it very simple for patients to really understand.
Dr. G, tell people how they can reach your clinic.
Yeah, so you can go to wangvisioninstitute.com. Our phone number is 615-321-8881. And then you can either call us, visit the website. You can also make inquiries through our website as well.
You know, I got to tell you, I want to tell you how much we appreciate Wang. This is a busy time of the day for you, and we appreciate you taking this time out. You're with us every month, but we replay your shows all the time because they are so important. But I just want you to know people love hearing you do the show, Dr. G.
No, thank you. I mean, thank you for giving us this opportunity. So we really appreciate it, and we really enjoy it as well. And so, hey, if there's ever requests for monthly shows, please let us know. I mean, we'll be happy to cover any topics you guys want.
You know, it's amazing. We still get people going, when is he going to talk about LASIK again? That's like still the number one topic. And we'll be doing a show on LASIK again. Thank you so much, Dr. G.
Okay. Yeah. Take care. Thank you so much.
You too, bud. And that's going to do it for us today. We'll be back again with you next month with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.